Thank you so much for the introduction, Gary. I'm so excited to be a part of Schein's Thrive Live event. Join me as we take a tour through technology where we're going to look at what's been happening over the past year and the new things that are coming on the market that are going to completely disrupt the dental industry. The first thing when you think of digital dentistry is you think of scanning, and rightfully so. That's kind of the cornerstone of any digital practice. And I'm so excited to be able to work with a group of individuals that are world-renowned in digital dentistry and at my fingertips to have access to over $4 million worth of technology. We have over 50 different types of scanners, varying from various manufacturers, and we use them all every single day. And I gotta tell you, it's really exciting the way that these scanners have changed, not only the way that we teach dental students, but the way that we practice dentistry ourselves. The first thing that we're going to discuss is scan and send. So in this concept, we essentially don't have a mill-in office, and we're scanning our patients, and we're hitting a button and sending these scans through a HIPAA-compliant network to your favorite laboratory. And maybe maybe this is a good starting point because, you know, as we see here, every scanner is essentially a rotational-based full-color scanner. They're all mostly open these days, and I have to tell you, it doesn't matter which one you get, they're all phenomenal. So we use all of these scanners, and I bet if you mixed them all up and I took the labels off of these, you could see that they all look similar. They're all very accurate. We get similar results back from the laboratory when we send off scans, and really what it comes down to is not necessarily the scanner itself, but the workflows that you're going to do with the scanner. So a scanner is just a starting point, and it's essentially, if you think of any digital scanner, it's capturing light information and converting that into dots and lines on the screen. And so these pixels or these point clouds are then transformed into a 3D model. And it really doesn't matter what scanner you're using to capture that information, because it's all going to be input into something that's gorgeous and something that's going to be way better than a physical impression when you send it to the laboratory. I mean, what would you rather see? A stone model or a physical impression, or something like this in full color, that you're able to see what's tissue, what's rubber dam in this instance, what's tooth, what's core buildup material. You're able to capture all that information in real time and full color and send and translate that information over to the laboratory so that they could go ahead and do this kind of work where they're designing the restoration digitally. They don't have to pour up models. They don't have to scan your physical impression, because 90% of all impressions that are sent to a laboratory are actually scanned digitally anyway. In this case, we have a different system here from PRIMESCAN, and you can see the color is really helping the technician mark these margins and to be able to see where the doctor was able to put the margins in this particular case. So all these types of different informations really help the laboratory as you're able to transfer these color models, which are often ply or OBJ. 3Shape's leading the way with not only just sending the color models, but also sending this 4D patient-specific jaw motion tracking to the laboratory. So with 3Shape, you could hold the scanner in the mouth and get the patient to slide into excursive lateral intrusion and protrusion movements, and you could see in real time the jaws following the patient-specific motion. That could be transferred over to a laboratory as well. And so, you know, you're getting not just an impression sent, you're getting color, you're getting jaw motion tracking in some instances. You're getting a lot more information than what is in a physical impression. And so what about the accuracy? Because who cares if you're getting all that cool information if it's not very accurate? And so this study was one of the landmark studies that actually looked at a human model instead of a typodont for accuracy. And what they found was 25 micron full arch accuracy, 18 microns for preps. Now, your average polyvinyl siloxane is going to be around 20 microns, and by the time you pour it up, you're up to around 40. So we're even finding soft tissue scanning is more accurate than physical impressions, where physical impressions here compress the tissues. With scanning, you don't have to worry about compressing the tissues. Software updates, in this instance, are taking a scanner and tripling the accuracy just with software updates. So even when you buy a scanner today, it's not the same scanner in 6 months from now, because it's going to get updated. And so it's accurate, it's got more information, but what about the patients? Patients love digital impressions. You know, it's scary if you think about it from the patient standpoint to have rubber kind of jammed into your mouth. Nobody loves it. Nobody goes home and tells their friends and family how awesome it was. But when you do a digital impression, it is a conversation piece that the patient will tell friends and family. They will post on social media. And this has been proven in the literature from studies like from Hacker that showed that anesthesia and impressions were the most dreaded parts of any dental appointment. And we know that from this study that patients unanimously prefer digital impressions over physical impressions. And if you take a trip down kind of the social media avenue of what do patients really think about the dentist and physical impressions in general, it's all negative. So we don't want to spread negative information about our practices, right? We want people to talk positively. We don't want to have to say, oh, I went to the dentist and I gagged on this impression or anything like that. So we could flip the whole dynamic on impressions and turn it from one of the most negative experiences for our patient to one of the most positive experiences for our patients, where they're talking about how cool it was, how they saw their mouth on the screen instantly in full color and 3D. You know, to us, it's not necessarily new, but to them, it's completely new. So this whole concept of scanning, they don't know about it. We've been hearing about it in the dental world for a while now, but to our patients, this is all very, very new, cutting edge, exciting stuff that's a really big differentiator in your practice, and it has definitely been for me. So let me just walk you through the patient experience real quick, because I think this is important. And this particular scanner happens to be the Emerald S, but it doesn't matter what you're scanning with. It's all the same from the patient experience standpoint. So here we could see this particular patient needs a few implants. They need a smile makeover. So we're just going to do some diagnostic impressions. And all the scanners are going to have this kind of high-speed rotational based scanning with full color, okay? There's not a scanner really on the market today that's not going to be able to accomplish a very fast scan, a nice color scan, and more importantly, one that's really accurate cross arch, right? Because we need these to be super accurate and very easy for the clinician to do or team member to do as well. Notice the patient's super comfortable, relaxed. Half the time they don't even know what's going on in my practice. The next thing you know, they look up and their whole mouth is on the screen, and they're like, how did that happen? And you're able to rotate and point out all sorts of things. Now, notice the soft tissue tracking here across this palatal vault. It's remarkable. Last generation scanners could not do this. All the new generation scanners can do this. So they could go across the palate with remarkable accuracy. In fact, more accurate than physical impressions, which tend to compress the palatal tissues by about 110 microns. So, you know, we're doing these studies and we're showing how accurate these things are, but we oftentimes forget the patient experience and how excited they are to see their mouth on the screen like this. And I always have front-facing monitors hooked up to my chairs so that they're able to experience and see all this. And it's not just for me, it's actually more for them. And so back to the soft tissues, this was another pretty amazing study where they took a cadaver maxillary arch and they scanned it with all the various different scanners on the market, and they found incredible accuracy for these scanners, guys. Another thing that's really cool with digital scanners is for denture workflows. Let's say you have a patient with a denture and it's a little bit ill-fitting. You could just reline that denture and then scan it in your hand. And you could scan the whole entire thing 360 degrees and send that to the laboratory, and they could do a copy denture on that. 3Shape has some amazing copy denture workflows from the laboratory side, and exocad as well. It's able to be done. So it's really cool to be able to just cut out a lot of the errors that occur with new dentures. So these copy dentures and these reline copy dentures are very, very, I would say, powerful for the patients, because you're not having to duplicate their denture and use it as a custom tray. You're able just to scan it right there in real time. What about dental implants? Can we do dental implants with our modern 3D scanners or intraoral scanners? The answer is yes. You could do dental implants and you could do them well. You could do multiple unit dental implants. JOCSTAD found that you needed anywhere from 100 to 230 microns of of accuracy and still get really good clinical success. And all the scanners are able to do, even in this hybrid all-on-X workflow with these very parallel scan bodies, we're able to do below that 100 micron threshold for accuracy. And so what does that mean? That means passive fits. And like I said, even if you're beyond that 100 microns, according to JockStat, you could have that almost up to 230 microns. You're still going to get good clinical results. It's really remarkable how much easier this workflow is to do with implants, because you're not having to cross mount models. And in other words, you're able to scan the provisional, you're able to scan the soft tissue, and you're able to scan the scan bodies and have it all go to the laboratory mounted. Okay, so you got a scanner and maybe you're wanting to move up to the next level. What is the next level? Scan, design, and send. So now instead of scanning and sending to the laboratory, you're designing and sending your design to the laboratory, not your impression, but just your design. And you're going to get a crown back from the laboratory for anywhere from $15 to $30, depending on what milling service you partner with. And all of the companies, whether it's PRIMESCAN, ZIRC, or 3Shape, they have phenomenal design software options that you're able to quickly design a restoration on your intraoral scan and send that STL file out to the laboratory. In the case of ZIRC, you get ZIRC in-lab, which enables you to export that STL. But by and large, everything's open and you're able to really just design it the way you want it. So the proximal contacts are under your control, the occlusal contacts are under your control. And once you dial that in and you get these restorations back model free, typically you just get a crown in a box. It's all under your control, and it costs probably 4 times less than if you farmed out that design. So if you just take it to the next level, you could really get a better ROI. And of course, the apex of kind of in-office stuff is milling in office. And there's a lot of new, exciting mills that are on the market that are really phenomenal. The PM1 from Ivoclar is a beautiful mill. The 30S from PRIMESCAN is a workhorse. It's tried and true. The Prime mill is blazingly fast, and the 50S mill is the first puck mill for design for in-office milling. So this is one of my mill rooms that I have. I have here the PROGA 1 right next to the 230S mills, and that's a 50S mill in the background milling some Emax ZIRCAD Prime, which is a multi-layer zirconia that goes kind of from 3Y to 5Y. And here's another one of my mill rooms. Here we could see we have some PRIMESCAN mills lined up. These have been workhorse mills for the past 6 years. We have some ZIRC MCXLs, and then we have our Prime mill here, which is for blazingly fast same day zirconia restorations. And it's just really fun to be able to use these, and no matter what you're using, you're going to get beautiful fits as seen here right out of the mill, not even trimming the sprue off of the block. So, you know, it's really cool to do same day dentistry and to be able to prep a tooth a little bit more conservatively and not have to prep for a temporary or anything like that. And we could use modern adhesive ceramics and you know, even using Emax or lithium disilicate, we could only have to reduce the tooth a millimeter for bonding that on. So it's really conservative. We don't have to drop the margins down to the tissue because these just blend in. You can't really see the finish line. It's just all beautiful translucent glass materials. You could do your nice adhesive technique here, and you don't have to worry about debonds or anything like that because of the modern adhesives that we have are so phenomenal. And we have study after study showing very phenomenal long-term success rates with these types of materials. So Emax has kind of been the cornerstone of my practice. And we even have studies showing that 1 millimeter thick occlusal overlays are phenomenally successful. What's more important for me is that we have studies showing partial coverage is just as good as full coverage. So sometimes when I have a patient, like in this case, that broke that lingual cusp, I don't have to shave the whole thing down for a crown. I could do an onlay. Insurance companies are starting to reimburse a lot for onlays. They're understanding that it's a phenomenal restoration. And these just are beautiful restorations. We have study after study showing that these partial coverage restorations are just insanely amazing for our patients. Here's a case with an occlusal overlay or a crown lay. And once you bond this on, in this case, this is Emax, you can't see the finish line. It completely disappears within the tooth. And I was able to preserve something called the biorim of the tooth. For all you kind of biomimetic guys, you will understand what that is. And so It's really cool to be able to bring that service to my patients and not have to be aggressive with tooth reduction and prep for a temporary. What about multiple unit things? Is this the next level of chairside dentistry? I say absolutely. Once you get more powerful softwares and try to get some puck mills in your office, you could do things like this. This is a case that we did most recently, and this patient had some occlusal issues. They lacked anterior guidance, they had anterior open bite, they had reverse smile lines. So quickly in PlanCAD Premium, we waxed this case up digitally, and we were able to kind of show the patient what they would end up with if they went through treatment. And of course, this software is extremely powerful now because we're kind of jumping out of the single unit chairside software and jumping into software designed for full service laboratories. So it could do, smiles, dentures, partials. It could do basically full mouth reconstructions and anything like that. So here we are on the day of delivery. We're getting some isolation here. This is the 50S puck mill, which also could mill blocks, and it can mill 3 blocks at a time. It could mill any one of thousands of puck materials, all sorts of types of zirconia, because this is a wet dry mill, so you're able to have that option. So here we are right out of the puck mill. In this case, we're doing in the block holder. So here we are dry seating on the day of delivery, and we have a really happy patient. So they went from having a reverse smile line to a fairly nice smile line here, and of course they're ready to do the lowers now. So it's this type of dentistry that you could bring in office and save thousands of dollars on every case. Zirconia is the cornerstone of many practices, and so milling zirconia, you really have 2 powerhouse options: the prime mill, and then you have the 50S mill from PRIMESCAN. So in this case, we have some complicated destruction of soft tissue here. The patient's been through several failed grafts. They're done with it. They just want a prosthetic now so that they can smile. So we're designing this to be as cleansable as possible. We're using, in this case, Emax ZIRC Prime, which is that beautiful kind of 3 wide to 5 wide transition here. So you have a very strong material where it connects to the tie base or custom abutment. And then you have a very translucent, gorgeous material at the incisal edge that transmits light and is very beautiful. And so here we could see milling this on the 50S puck mill, and we go from design to reality, and we're able to basically just screw this in for our patient and take them from something that's not so nice to something that blends in. And thank goodness for low smile lines in that instance. And it's not just prosthetics that we could mill. We could do occlusal appliances that are world-class because a lot of my patients are coming in with extreme occlusal issues, and I dread taking impressions and sending these off to a laboratory and wondering when I get it back, how much adjustment I'm going to do on it. But I have all the control in my office, and so on my patients that have severe occlusal issues, I'm going to take an ultra low dose CBCT. And our CBCTs that we have on the market now are just fantastic with the dosage. We could take this full skull scan at under 30 microsieverts of effective dose, which is less than a full mouth series. So here I am, and this is PRIMESCAN Remexis. I'm using this software to measure the condylar inclination that's specific to this patient. Basically, we drop a Frankfurt horizontal from porion to orbitali, and then we measure the crest of the articular eminence and glenoid fossa and drop a angle to determine this patient's specific articular inclination of their eminence. And then we're able to pin their intraoral scans to the CBCT here, and now we're able to virtually mount this on the articulator using Bergstrom's point, which is about 10 millimeters anterior to porion and 7 millimeters inferior to Frankfurt horizontal. And we're also able to get the upper arm of the articulator parallel to Frankfurt horizontal or Camper's line. And so you can see we're actually dialing in. This is kind of the ultimate face bow mounting, if you will, because you're using actual values from the patient versus some arbitrary and empirical values from something else. And so when we go through and now we open the articulator pin, plus we're dialing in the custom articular eminence here, of that condylar inclination, we're able to get better values for our occlusal appliances. In this case, we're using PlanCAD Premium here, and we're able to work out the guidance. Now, whether you're using a full arch permissive splint or you're using like a Dawson B type splint or a lower E type splint, it doesn't matter. You could do it all in this software. It's really phenomenal to see the final results, whether you're milling or 3D printing these. And so here we could work out the lateral movements and anterior guidance here. This is just a standard full arch permissive splint where we have anterior guidance and posterior disclusion. But like I said, you could get more fancy with your appliances. And there's even ways to do sleep appliances if you want to be creative, but you just have to be careful there that everything's worked out with insurance, because typically you have to be from an approved center to be able to do in-house sleep appliances. So a lot of fun things coming down the pipeline with this type of software. And here we are milling it out of a puck of lab processed PMMA, and you can see the excursive movements are just perfect in this particular instance. Okay, enough with milling. Milling's fantastic, but 3D printing, I think, is kind of the future of where we're going. And this is one of my print rooms. These are not the most pretty of print rooms because these are kind of messy areas. These are typically areas I don't like to take patients to because there's just dripped resin everywhere, especially if you're actually using your machines. This is my metal printer. And what's really cool is that during COVID, we kind of switched gears and went from printing dentures and things like that to printing respirators for people all around the world. And we did nasal swabs when there was a shortage of nasal swabs. We did respirators, all sorts of really cool things using our very cool printers that we have in the dental world. And here's one of my designs that I design, a respirator that snaps in a HEPA filter. So what about occlusal guards for 3D printing? Well, there's some revolutionary new materials that have come out that make 3D printing occlusal guards a reality. One of them is Keystone. Keystone has a phenomenal material that is actually a thermoplastic, so you could heat it and finalize the fit to the patient's mouth, which saves a lot of chair time. You could work out the appliance design in any software, whether it's exocad, 3Shape, PlanCAD Premium, CEREC, InLab, whatever you want to design it with, but then you could have the option of milling that file or 3D printing that file. In this case, we're 3D printing it. This particular printer is called the D4K Pro by EnvisionTech. It's a really cool printer, and you know, of course, it's more about the resins than it is the printers specifically at this point. Look at how perfect the occlusal marks are on that. Surgical guides. I can't even tell you how much of a game changer surgical guides have been for not only the university here, but also our practice. A lot less errors during placement. We find that our surgical procedures are taking half to a third the time that they used to take. Our patients are calling back a lot less because we're not having to flap as many cases. And if we do flap, it's very minor versus before. To get visualization, we have to do these major flaps. So here's a patient. This is the patient that we scanned earlier. Now we're just bringing him in and we're going to do a little wax up because they're interested in some implants. They're interested in maybe getting those anteriors redone. They're not super happy with their smile. And so here we are in PlanCAD Premium, just waxing this software, waxing this patient up in this software is really easy and fast. It's almost like setting a denture. You basically can move teeth individually or all as one unit in a chain mode. And of course, you could throw on any kind of smile design software that you work with, and you could overlay that to get your proportions right. Also, you could use the intrinsic smile design software that's built into this particular program, which is really powerful as well. And what you're able to do from this is severalfold. You could either 3D print shell provisionals, okay, where you can mill snap-on smiles or print snap-on smiles to show the patient, or you could 3D print a monolithic model. In this case, what we did was we 3D printed this wax up as one unit. And what we're able to do with that then is make a putty wash on that wax up. So here the patient is, and here we have a putty wash of the 3D printed wax up, the model. And we're going to transfer it to the patient's mouth because this was an additive wax up. We have the ability to do that without having to shave down the teeth at all. And within about 60 seconds, this is going to be pulled out of the patient's mouth, and what's going to remain, because of the accuracy of the intraoral scan and the accuracy of the 3D printer, The only thing that really remains is what was added digitally. So you don't have a lot of flash all over the gingiva and palate area. It's basically non-existent. You could flick it away with an Explorer, and what's left is just the perfect, beautiful wax up that you did digitally, which the patient was a part of. I like to have all my patients involved in the wax up because they're truly blown away when you show them that wax up and you do this procedure for them, versus if you think traditionally what we used to do is snap an alginate, fire it off to the laboratory and get something back in physical wax, right? And then show the patient like this, you know, what do you think? Whereas this whole process where they see it first digitally, and then they see that digital become reality through 3D printing and injection molded kind of wax ups like this, the patients get truly invested in their treatment. We find our acceptance rate is through the roof when you do this. They get emotional. Oftentimes they start crying. They take selfies. They show family members. They're very, very excited about this process. And this does not take a lot of time or talent to do because everything's done digitally. You no longer require the ability to perfectly mirror image teeth using physical wax. It's almost like cheating because the computers do everything for you. All you have to do is 3D print it and transfer it to the patient's mouth like this, and you could see how excited this patient is. As I often video them speaking and going through some phonetics, looking at incisal edge length, making sure midline's on, making sure everything's okay. And then what I also love to do is break this off in half, kind of a hemi arch. So I'm going to take off one side and then let the patient look in the mirror, because you'd be surprised how fast they forget of what is underneath them. And so then the patient's usually shocked and they're even more ready to go through the treatment. I can't tell you how much of a game changer this alone has been. So if you do nothing else digitally, if you just do this, your practice will definitely benefit from it. So this particular patient needs some implants. So here we're using, in this case, Viso CBCT from PRIMESCAN. A lot of good CBCTs on the market. This just happens to be the ones that we use. So we have the ability now to do ultra low dose imaging that we would never have dreamed of 5-10 years ago. It's just standard of care to take 3D images now. We could take 3D images, less radiation, effective radiation than a pantograph. So there's no excuse anymore not to be able to do this. And there's just so much excitement from the patient when they see their CBCT, and I always sit down with my patient. So, and actually this is what we're doing here. So the patient's sitting down with me here, and I'm going through their images. I'm showing them really quick their smile design, and then I'm going to bounce really quick to their 3D image. And now we're going to go ahead and plan these implants. The patient has been elsewhere for consults and they were told they might need grafting, they might not, they won't know until they get in there, all sorts of things. You're going to be able to definitively tell this patient not only what kind of grafting they need, if any, but exactly what implant sizes we could fit in there. And then I also go through the whole thing of these are going to be completely guided. I call it pinholes. We're going to just do tiny little holes in your tissue. We're not going to have to do major grafting. Here the patient has a radiopaque lesion that I'm highlighting in 3D for them, and then I'm going to be able to show them that. I could hit a button and instantly send this off for a path report to a service to be able to read that for me if I was uncomfortable with developing a differential diagnosis there. So you could partner with various services. And so now here in this particular planning software, I'm just throwing in some implants. There's hundreds of implants to choose from. We could do fully guided, we could do pilot guided, we could put various different types of sleeves on, but the patient's sitting here and I'm throwing these in here and I'm just really quick for the patient and telling them exactly what we're going to need to do, whether or not we need to do a sinus bump or not, and the patient's blown away. You have to remember they've been through several consults, nobody sat down with the patient and did this with them. Now it's even more impressive to the patient is I'm able to bring in that wax up that we just did and pin it to the CBCT in 3 dimensions and also throw on the wax up as well. So here we are bringing in the diagnostic wax up. So we have the teeth in there for a truly restorative driven top-down plan. And I could definitively now say whether we could do screw retained or whether we're going to need custom abutments, angled screw channels. I could understand a little bit more what I'm going to need on the restorative side, which also starts to set the tone for the price as well. So here we are on the day of surgery. Everything's just perfect. Everything goes through the guide. There's no stress. There's no guessing. And everything is identical to what you planned. There's no curveballs. There's no staying up at night the day before surgery and wondering what you're going to run into when you do the surgery. And for the patient as well, the recovery time, this patient had zero issues. They were back at their full normal routine the same day. They took an Advil. So it's like, you know, sedations go way down when you explain this, because patients' anxiety levels go way down because you're telling them that you're using the latest technology to ensure that everything's going exactly where it is, and that there's pinholes, and that there's not huge surgical procedures, unless of course you need to, like whether you need to do a flap to preserve keratinized tissue, or if you're grafting with the implant, of course there's still definitely a place for that. But as you can see here, the whole process is, for each implant, is under 10 minutes. More importantly, the stress level is zero. I mean, I can't even tell you, when I have a plan like this and a guide like this, it's the easiest part of my day, where it used to be a little bit stressful, freehanding and wondering if I was going to be exactly where I needed to be, if I was going to be paying for it on the restorative side with expensive components because of malplaced implants. And I have full control over this. There's nobody to blame but myself. Everything is in my hands, if you will. So I love it. I love the ability to be able to do this for my patients. And 3D printing, of course, is not just about doing the status quo. It's about being innovative. And so one thing that we're doing is we're adding irrigation channels to 3D printed guides. So we could 3D print these channels. And so when you step on the rheostat of the implant drill in the handpiece, you could get irrigation fluid pumping through the guide, cooling the osteotomy site and the drills. So here we could see these channels going through the surgical guide. And so we basically just put a little tube up to that entrance port there, and we don't have to think about irrigation. And what that's done for us is it's really freed up our assistant to be able to focus on other things besides cooling the bone. These custom ejection ports are not that hard to do. You couldn't mill something like this. It's something that would have to be 3D printed. So in this case, we're having to do a little flap here to preserve some keratinized tissue and put a little bit of bone there at the end. But you could see here the guided cooling, where the fluid is traveling through the guide and spraying onto the drill below the sleeve. So normally it comes out of the top of the handpiece and just hits the guide, and nothing is getting to cool the actual drill or the osteotomy site. But here we're able to guide that fluid down below the sleeve, and therefore cooling that drill. So some really cool things with 3D printing, guys. It's basically whatever your imagination could design, you could 3D print. Another thing that's really kind of revolutionary is printing custom healing abutments. For a while we were getting these done by milling service, which is fantastic, but using most softwares, you're able to pre-surgically print these custom healers. And so you place your implant, you get it to the proper timing. Some guide softwares are you're able to do timed implants, and you're literally just going to screw in that 3D printed custom healer. Beautiful, beautiful way to sculpt that tissue and have it be perfect for restorative. Shell Provisionals completely changed everything for us here. I hate injection temporaries with putties and bisacryls. We're able to have our temporaries 90% done before we actually touch a tooth. So here's a patient that came to us like this, has some issues going on. We did like we always do, full upper and lower diagnostic wax up, made sure that we were able to work everything out digitally, including the occlusion. And here's some 3D printed shell provisionals. These were printed on the Sprint Ray Pro. And we're using Ivoclar's Empress Direct resins to be able to characterize those shell provisionals, and that palatal stop is a vertical dimension, vertical stop that gets cut off after you reline these. So you're gonna seat that with some bisacryl in there or acrylic, and then you're going to pick it up and then take it off and trim that off, and then put some temporary cement in there. Here's another one for the lowers. Like I said, these have been so phenomenal to be able to 3D print these restorations for our patients. And there's some exciting new materials coming out on the market that are permanent restorations, and then Envision Tech has some amazing materials coming out as well for that are exceeding the limits of strength. So for your hybrid prosthetics and things like that, resins are so exciting. So we take this guy from that to in one day with our 3D printed provisionals. Here's a permanent crown and bridge material that's coming on the market, so we don't have to just do provisionals anymore. Here's another case. We're doing some aesthetic crown lengthening here, and so we're moving that tissue up. We're also removing some bone, and we're going to do this whole case digitally using 3D printing. And you're going to see it's going to make the whole entire surgery a lot less stressful, because we're going to be able to know exactly how much bone we need to remove and where. And so we're designing this custom surgical guide. And this guide not only is for an implant that we're going to place, but it's also for the soft tissue removal and for the hard tissue removal. So we snap this on the day of surgery, and that's going to guide our soft tissue removal. And this was all designed with, of course, CBCT, and then using surgical guide software, we're able to design this and measure out 3 millimeters for osseous removal after we do our soft tissue removal here, which is based off of our diagnostic wax up that the patient approved. So here you can see we're creating these windows. I remember doing this the old way with like suck downs and all sorts of things, and it never really worked well. This is precision right here. So we're able to cut this 3D printed guide back right at the CEJ of our future proposal for our wax up. And then we're able to make the top bar of this 3 millimeters or 2.5, depending on biologic width specifications. And we're able to measure that to make sure that we're at exactly that number. And so that's going to do our ossectomy, our bone reduction to that level to ensure that we have that perfect biologic width there. And so we're going to use not only this as a soft tissue guide, but as a hard tissue guide during surgery. And this is super low stress. You're doing this, there's nobody around, the patient's not in the chair. And what it does is on your most valuable time is patient sitting in the chair time, right? I could cut that down by 80% by doing this beforehand, and my stress level gets cut down by same. And so it's all worth it. And then, so we slide that implant in right there, and then we're gonna have our 3D printed provisional here. And then we're gonna go ahead and do our surgery, reline that provisional, and the patient's able to walk out with temps without having to worry about making temps after that surgery. Digital dentures, revolutionizing the way that we do dentures. You didn't think removable could be cool, but it's cool again. We're doing hundreds of these types of cases. Your 41-year-old denture, turning them into new dentures by basically just relining that and making copy dentures. Here's another case where we have a very old denture here. So we're gonna grind out that old reline material, do a fresh reline, and then put it in a box scanner or an intraoral scanner, scan that, okay? And then 3D print a brand new one. So here we are using, in this case, 3-shape copy denture workflow. And we could either 3D print the base, mill the teeth, 3D print both, or mill both. And of course, Ivoclar has some amazing innovations with their iVotion pucks, and they're really pushing the limits of dentures. It's really cool to see. 3D ortho, we're able to use various different softwares. There's maybe a dozen different softwares that you could design, or services where if you didn't want to do this tooth segmentation and movement and you were uncomfortable, you could send your intraoral scans to a service who will do it all for you, and you have the ability to check and make comments, and they will send you the files back for like a $250 fee. And then you would 3D print all those files in Office and save right around $500 to $800 a case, depending on the case. So here we are. In this case, I'm doing it myself. Auto segmentation, we're able to add as many attachments as you want. In this particular case, I've also combined with CBCT so that when I'm moving the teeth, I'm able to see where the roots are in bone, and to make sure that I'm not going to cause any premature dehiscences or fenestrations, and make sure that I'm being realistic to what this patient presents with. And you're able to do interproximal separation as well, and you're able to instantly check occlusion in most of these softwares. And this just keeps getting better and better and better with artificial intelligence. I see a time when we're just going to hit a button. In fact, it's already really here. The software does everything for you. You're able to show the patient before and afters, and then off to the printer where you're 3D printing something called aligner bases, where you're going to 3D print these, in this case, the Form Labs here, and we're going to do positive pressure suck down on these to make our own clear aligners. There will be a day when you actually could 3D print the actual clear aligner itself, but nobody's really doing that right now, not even in your major services. So hybrid prosthetics, switching gears now. I love doing these all on X cases, and I love 3D printing the provisionals. Here's a case that I'm doing. That palatal stop is just to pick it up at the proper vertical, and then we'll cut that off. You're able to add resins to characterize these, to turn them into something that's decent looking, and various different materials in the market to be able to add pinks and various different colors to the 3D printed materials to really make them pop and turn lifelike and aesthetic. Many different types of stains coming on the market that are phenomenal. What's more important is there's new materials coming on the market that make 3D printed stronger than milled, as far as it relates to acrylic, PMMA, and resin nanoceramics. So look for that. There's some exciting stuff, especially from some key leading manufacturers on the laboratory side, and Vision Tech has some extremely strong materials coming out that you're going to be able to use. And so here we are. We're just on the day of surgery picking up the temporary multi-unit cylinders here, and we have our holes pre-cut. We inject, in this case I like to inject good old PMMA into the area to lock onto those temp cylinders. Then you unscrew the whole thing, cut that palatal stop off and polish, and then screw it all back in. So, you know, this was all pre-surgical. Here he is with his finals. Very happy man. Everything was super successful in this case with that 3D printed hybrid prosthetic. All right, we have time for one last case. This patient's missing tooth number 8 and 9. I'm going to do a quick intraoral scan. This is obviously extremely sped up for time, just because I know you know we don't want to sit there and watch the whole entire scan, but basically it's upper and lower digital impression with a bite. Okay. Now what we're going to do with this case is pretty unique. We're going to go ahead and plan this case surgically, okay, using implant planning software. We're going to go ahead and merge our diagnostic wax up. And what's really cool in this case, we're going to combine 3D printing and milling. We're going to go ahead and 3D print a surgical guide, and we're going to mill some pre-surgical prosthetics. So here we go. I'm virtually placing the implant, literally hundreds of implants to choose from. You could go ahead and place your implants here. You could parallel them, implant centric view to make sure that everything's within bone, that your in this case, screw access ports are going to be coming out the cingulum of your restorations that you waxed up. And so here we can see I'm measuring to make sure that everything's okay. And paralleling to the other side. This is just routine stuff. Now what's cool, this is kind of unique. I'm attaching virtual scan bodies to these implants. What that's going to do is let me export everything into any laboratory software and be able to design prosthetics from this plan. So here we are in PlanCAD Premium, which is basically customized exocad. And my digital wax up, I'm able to cut holes right in my digital wax up. Remember, we haven't even placed these implants yet. So here's my wax up here. Those are my final prosthetics that will slide onto my tie base. And so here we are now. We went ahead and milled the prosthetics. We put our tie bases in. We have our surgical guide 3D printed. And now on the day of surgery, zero stress. So what I do in the day of surgery for this particular case, I mark the lingual aspect of the implant by modifying a punch. So I'm going to go ahead and put that through the sleeve, and then I'm going to do these micro flaps where I'm just going to basically do these papilla sparing flaps here, where I'm going to go ahead and roll that keratinized tissue to the facial, place my implant, and then I'm going to do a roll graft where I'm going to go ahead and de-epithelialize and fold that into the papilla area and suture that so we get the papilla to grow there nice. And those are the prefabricated, pre-surgical prosthetics that were milled, zero work done, just screwed those in on the day of surgery. So I have to tell you guys, digital dentistry is phenomenal. Thank you for your time. I hope you have a kind of a glance at what's going on in the world of digital dentistry.